Hello, everyone. This is Mark Anthony with Dr. Mo Karim. I'm really excited today. We are, he's coming from iowawellnesscenter.com, iowawellnesscenter.com. If you're looking, guys, I'm going to be very upfront. If you're looking for the number one neuropathy doctor, and I mean hands down, period, who gets things done, you're going to want to go to iowawellnesscenter.com. We're here to bring you the best of the best doctors in their niche and in their area. And if you're in pain, neuropathy, there's so many people out there that think they have to live with it. Now, I can say this because I'm not a doctor. Don't listen to everything that you hear. If you have nerve pain and someone says, quote unquote, doctor, that you can't be healed, please pay attention to this. I have one of the best neuropathy doctors in the Iowa area. And today we're going to be talking about that. And so again, I want to say thank you so much, Dr. Mo, for being here. You are an amazing guy. I can actually call you my friend. And thank you so much for being here on the show.
Thanks, Mark. Thanks for having me. And yeah, it's always great to see you. And
No, definitely. It's too long, man. We got to go back out to eat. I have to go connect with you at another Barlow meeting, which hopefully it'll be really soon. Miss them.
Yeah, it's been a while. But I think last time I saw you was right before COVID. So it is due.
No, it's due, my friend. So today, it's the topic. And a lot of people are asking this out in space. They're asking, do I have to live with neuropathy? Do I have to live with pain? And a lot of people have been told that they have to live with this for the rest of their life, take all the pills that will patch up the symptoms. What would you say about that?
Mark, that's what we hear every day in, day out. Usually we're like the last resort or last hope. But yeah, we hear it all the time, and I'm gonna just say it out. It's not true. I mean, we see lots of patients with different symptoms, and it's not just pain, Mark. I mean, some people will come in and be like, "Hey, I don't have any pain, but I have numbness, tingling, maybe cold or hot sensations in the hands or feet." Um, so it doesn't have to be just pain. It could be lots of different things that they're feeling. But no, I mean, nerves are cells.
Mm-hmm.
So if you get cut and it heals, well, that's the same thing. You cut your muscle, you cut your skin, all that heals. Those are cells that start to heal. Well, that's the same thing with the nerves. The nerves are a little bit more complicated, but again, they need the oxygen, the nutrients in order for them to come back and regenerate again.
Mm-hmm.
Typically, they're not regenerating, and that's why the symptoms are getting worse, is because it's not getting the circulation to the area. And we'll talk about that here in a bit, how that is affected, because really it all comes down to the brain telling the heart, hey, this area is not working as hard as it used to anymore, so I'm not going to give it as much blood supply naturally. So we need to get that working again in order for you to get the sufficient blood flow and circulation and oxygen and nutrients back to that nerve.
Interesting. My question to you would be, and this is things that I've heard many people say, and I've thought about it too, that when we get older, when we hit like our 40s, 50s, 60s, 70s, and plus on, that those nerves get weaker, and so they end up dying. So when they're dying, are you telling me they can actually come back to life, or they're pretty much done? We have to put new cells in there, or how does that work?
So I mean, dying is I mean, I wouldn't say they're dying. I mean, best way to explain it is kind of like a plant.
Mm-hmm.
Okay. If you have a plant, it's got thick roots that are going down into the soil. Off of those thick roots, there are tiny roots, and off of those, there's micro hair-like roots, right? So what happens when that micro hair-like starts to die off?
It's weak.
Yep. The next smaller vessel will start to die off. Then eventually the bigger root will start to die off. Well, if you got the micro blood vessels that die off, which is typically what happens with neuropathy, because those are the ones that are feeding the nerves. Okay, so you've got big vessels in your body, and off of those there's tiny ones, and then off of those there's micro blood vessels, and those are kind of what are feeding the nerves, right? So if those start to die, same thing in the plant, right? Those start to die. Well, the next vessels are going to start to die, and then eventually the thick vessels are going to start to die. So what we're doing is we're trying to rebuild that micro blood vessel again and regrow that micro blood vessel to go to that nerve. But not only that, at the same time, nerves are supposed to fire at a specific rate. They're supposed to fire at 270 miles an hour. Okay. When you start to have these symptoms, that nerve is decreased. I mean, sometimes it's like way below 50 miles an hour. So it's really slow. So that's why the brain isn't recognizing it. So that's why circulation is decreasing. So that nerve cell starts to die, right? Or starts to diminish.
Okay, there we go.
Okay. And what it is the myelin sheath, which is the covering or the coating on that nerve, starts to basically decrease in size, and think of it as it starts to get holes in it.
Okay.
Yeah. Okay. And you need the myelin sheath for the communication back and forth to the brain. So what we're doing is getting that myelin sheath coated again and getting blood supply to the area and getting the nerve to fire back up again, so things can start to work again.
Okay, that makes a lot of sense. So my next big question would be, why are, without saying the name, I guess I can say it, why are a lot of doctors saying that it can't be healed? And they've been to medical school just like you and stuff like that. It just kind of baffles me. I mean, why
You just said it, Mark.
Yeah.
You just said it. They went to medical school. Okay. So they learned medicine. And that's what they know is, okay, I'm going to give medicine because this is a symptom. So I'm going to try and give it for the symptom. But really, realistically, medication really isn't supposed to be used if you go to like a store or anything just to get over-the-counter medication. You'll say, do not exceed 15 days. So anytime you go beyond 15 days with any type of medication out there, your body starts to get used to it. And then what tends to happen is down the road, well, it's not working anymore. Okay, well, let's up the dosage. Well, that works. Okay, now it's not working. Well, we'll up it again. Well, this is not working. Well, let's try something else. Okay. But also sometimes what happens is you start to develop a new symptom. So now we're going to mask it with another medication. So when we get patients in, sometimes they have 20 plus medications.
Wow.
And I go, first question, I go, do you know your medications? Do you know why you're taking each one for? And a lot of times they're like, no. I went to 4 different doctors prescribed, different medications. So it just counteracts over time. Okay. Those are chemicals and toxins that you're putting in your body. So yes, it's not going to help the pain or the symptoms. It's just going to mask it for a while, but then eventually it's going to get worse.
So the hole is going to get bigger, what
Yeah.
you're saying. Right.
Yeah.
So what do you do with someone that says, hey, I'm taking 30 pills a month, or 30 pills a day? Like how do they wean off of that if they're going to start working with somebody like you? What would the process look like? I mean, what is your process and stuff like that?
So when it comes to medications, so there are some medications that the patient, if they choose to, can start to wean off. But there are medications that you can't. I mean, if someone's on a heart medication or like a diabetes or, just like the major things,
Right.
you don't want to get off of it. But what happens is when someone starts a program with us, they'll start to feel better. And especially like diabetes type 2, I've reversed so many diabetes type 2. Okay.
Wow.
And they can monitor that. So they can see, hey, I'm going to take my blood test, prick their finger, do the test. Well, okay, I don't need as much insulin anymore. And that's where they start to regulate and not use as much medication. But typically I tell them after 3 months, I do want you to go see your medical doctor, go get blood tests done again, because you're going to get off of some meds, and you're probably want to ask if you can decrease any of your medication dosages. And that is typically what happens. Either they get off of, and typically they'll get off of, I would say 3/4 of all by the time 3 months comes in play. But yeah, my process basically is, when I'm evaluating someone, I'm evaluating them as a whole. I'm not just looking at their feet or just their hands. Like I said, the brain, that's the hub. So we need to test the brain. We need to test the spinal cord. We need to test the peripheral nerves, which is the nerves are coming out of the neck or the lower back area, and they're kind of extending out down into your arms or legs. So we're doing a detailed exam where I'm checking all these pathways to see, well, if I touch your toe, your big toe, is your brain recognizing that I'm touching it or not? Okay.
Wow. Okay, I see what you're saying.
So a lot of times when we're testing and it's a pretty severe case, they're not feeling where I'm touching, because I'll be like, which toe am I touching? And they're like, I don't know. I can't tell.
Wow. And they didn't
So
know.
do it to their hands, and sometimes in their hands they won't know which finger you're touching, and you should be able to do that.
Wow.
So really, it's processes for a patient is, they call us up front desk schedules them. We do a detailed consultation, get basically everything about your history, and then we dig into the exam. The exam takes about an hour to do. Okay, it's all hands-on. I don't have a machine that tells me if you've got neuropathy or not. But yeah, like I said, we're testing the peripheral nerves. So it's like sharp sensation, light sensation, cold, heat, vibration. So different things that we're testing. Those are different sensations that different nerves will react to. So we're trying to see, well, is it normal or not?
Mhm.
And once we do that, then we can figure out how much nerve damage, how much sensory loss you've got in each extremity. Then we get into the more detailed examination where I'm testing the brain. So a lot of brain testing where I'm seeing is the right side of the brain working better than the left.
Does it go at you past?
Yes.
Oh,
Yeah. Are you seeing where I'm touching? Are you, so there's lots to it. And then at the end, so that'll be day one. And then I'll usually have the patient come back in day two, because then I have to put it all together.
wow.
It takes quite a bit of time for the testing, and then just putting it all together, kind of see, well, is that patient a candidate in the clinic? Can we do something for them? And if we can, what is it? What's the best thing that we can do for them? So it's a detailed, customized plan for each patient that we do.
That's amazing. And, and I just want to stop for just a second. Everyone out there that's listening on Spotify and all the social signals right now, I just want to say something. When was the last time you went to a doctor that spent an hour with you? I want you guys to just think about that. There's so much importance here. I go to a doctor, they see me for 3 minutes. I mean, what kind of examination? Just imagine if you guys owned a car, if you went to your mechanic to see what the problem is, and they just spent 5 or 10 minutes and said, okay, it's going to be this. That doesn't make you feel safe. See, Dr. Mo, he's going through the entire system of your body, because there could be other factors that are happening that are hidden or that are about to happen. And he focuses on trying to find all those. Am I speaking out of correction, or if I'm incorrect, please let me know.
Yeah, because typically it's not one thing that's causing, it's multiple things.
Okay.
Multiple things. So if you're just concentrating on the feet, so hey, my feet hurt, right? It really, that's just the nerve. So it really comes down to 3 components that we need to hone on. And if you're only working on one, the other 2 you're not working on, that system's not going to work. So you have to work on all 3 at the same time in order for it to work. If you're only working on 2 or 1, it's never going to heal. And what I'm talking about is, the first one is your nerves.
Mhm.
And that's the symptoms. So, hey, I've got burning. Hey, I've got tingling. Here, take some pills for that. We'll decrease some of that, right? And that's usually the main thing that most doctors will look at.
Mm-hmm.
I guarantee that none of the patients, and I always say that, have that their doctor have talked about all three at the same time.
Mm-hmm.
And the second one will be circulation. Okay. I'm not talking about the big vessels again. I'm talking about the micro blood vessels. Well, are those sufficient or not? Right. Are those working? Are those there?
Mm-hmm.
Okay. So we need to check the circulation. And then the third is metabolic. And that's inflammation. That's where inflammation comes from. Okay. Metabolic is your gut. Your gut is your second brain. That's where 80% of diseases come from. That's where inflammation comes from. So diseases that I'm talking about that come from the gut will be diabetes, Crohn's disease, ulcerative colitis, fibromyalgia, which is a huge neuropathy, restless leg syndrome, another big neuropathy. So there's thyroid problems, lots of things that are coming from the gut.
Wow.
Okay. Your gut's your second brain. And that's where inflammation comes from. Inflammation likes to target the joints. So any joint pain, so back pain, neck pain, shoulder, elbow pain, that's all inflammation. And then typically it'll attack the nerves. So that's the burning, the numbness, the tingling. That's all come from the gut. So if we're not addressing all three, it's never going to heal. If I'm just doing the nerve and the circulation and not doing the metabolic, then we're never going to get rid of that inflammation. So it's going to come back.
Well, would you say the reason why or how diabetes is started is basically mostly the food that we're eating? Would you say that's the beginning, or what would you say about that? I mean, where this beast is coming from, basically.
Diabetes,
Yes.
you cause that. If you have diabetes type 2, you cause that. Okay. It's what you put in your mouth. Okay. What you're feeding yourself.
Mm-hmm.
If you're feeding it junk, you're going to get junk, which is diseases, right? If you're feeding it clean things, then you're going to get a clean body. Okay. So that's why I'm able to reverse type 2 diabetes.
Okay.
Because we're changing their food habits.
So could they still eat their bacon and their white rice and stuff like that, or is it a total Backstreet Boy where it's totally different? Now I'm just going to be eating lettuce all day.
Well, that's a good question. I think we need.
Oh, that's another guys. That's another podcast. We're going to do a podcast about gut health because
Health is just a topic. But yeah, I mean, there are foods that are good for the body and foods that are not. And there's lots of research out there that show what's inflammatory to the gut and what's not. But yeah, I think we should do a podcast on gut health, and we'll get into details on that. But it's definitely the foods that you're feeding your body is what's causing the diabetes. So when we start to feed them cleaner, better foods, and that starts to go away, and then eventually goes away, then a lot of times they'll stick with it because they don't want to feel crappy anymore.
Okay, well, kind of segue back into neuropathy. Would you say that the main thing that with neuropathy would be normally because of the blood flow, or is that just part of the issue? Because if your blood flow is flowing fine, there's not going to be inflammation. Because am I correct? Or
It's all three components.
okay, the three components. Okay.
It's all
Back to
three components. If
inflammation.
one goes out, the other two are eventually going to go out.
Mm-hmm.
Okay. So with neuropathy, so people will be like, hey, doc, how did my neuropathy start?
Right.
Well, we don't know. Okay. That could be when you're younger, an injury, right? A chronic low back for long time while you're compressing on these nerves. And here, so there's my model.
Yeah, put it in the middle.
Right here, right.
There we go.
Yeah.
There we go.
There's my model, right? This is the front of the spine. This is the back. You've got these spinal nerves that come out. These spinal nerves come out from the neck all the way down to the low back. Each spinal nerve has 9 tiny nerves in there. There's 2 for pain and symptoms, 2 for circulation, 4 for muscle, 1 for balance and coordination. So that's why you can't always judge it by pain and symptoms. Only 2 out of 9 nerves are causing that. So if we're talking about the low back, well, you've got 5 thick nerves that come out of the right, 5 out of the left. Each one has those tiny nerves. Those tiny nerves branch all the way down into your toes. Those are called the peripheral nerves. Okay.
Okay.
So if your spine has been compressed over years and now you're pinching on that nerve, well, think of the nerves as a water hose. If I've got the spigot open 100%, now I put a big rock on it. Well, now you've got 50%. I leave it for another year. Well, now you're about 40% coming out. Another year, well, 30%. So that's why that nerve starts to decrease in activity. So it's not firing at that 270 anymore. And then the brain goes, hey, you're not working as hard as you used to. Hey, heart, let's not give it as much blood supply.
And now we start the problem, the
Yeah.
situation.
So it's just a chain react.
I see. So if one's off out of the 5, let's say out of the 5 on the right, 5 on the left, if one's out, it starts the deterioration of the other ones. They start like spark plugs. That's
Yeah. Yeah. So, I mean, that's one, diseases like diabetes is known to cause neuropathy, right? Fibromyalgia is another type. So there's known conditions, there's unknown, injuries, accidents, surgeries. A lot of times they nick nerves when doing surgeries. So there's a lot of times when a patient comes in, they've had multiple things that have been piling up over the years that have caused that neuropathy.
oh wow. So what would you say is, I'm sure there's many people out here just listening, and I know that a lot of people have given up because of what they've heard. Like we talked about, the doctor said, hey, you know what, just take these pills, you'll be fine. And these people have kind of given up. What would you say to people out there that have given up and they're now living in that mindset that I'm screwed. I'm just going to sit back and just deteriorate?
Well, that's always going to be up to the patient. If you're wanting to do something and get better and create memories again especially with loved ones, I mean, that's the biggest one that we see is, and I'll ask them, why is it that you want to do something about it? And they go, well, because when I go on vacation, I have to sit back and my family can go and do everything else. And I don't want to be a burden. So a lot of times it's if you're wanting to continue with life and have a better lifestyle, then yeah, pursue it. If not, and you've given up, that's going to be up to you. I mean, so it's really up to the person. And then mentally, are you ready to change what you're doing?
Mm-hmm. Right.
Okay. Because you're doing it every day. And if you're expecting a different, reaction from it, by doing what you're doing every day, then it's
Sanity.
Yeah. That's
Doing the same thing over and over, expecting a different result. What would you say the numbers are right now? The average numbers of how many people probably have neuropathy worldwide, just maybe like an average that maybe some case studies that you've seen that have been affected.
I mean, those numbers are going up. I mean,
they're not going down every year.
They're going up every year. I mean, they're saying just the U.S. population, they say, I mean, just 40% have the symptoms of neuropathy, and that's increasing.
40%. But could you imagine what the 60% have? Whether it's neuropathy, I'm just saying, like, those numbers are interesting. Wow. So
keep going up, and it's, look at diabetes, how that's gone up, and or obesity, that's gone up. So again, it's the foods that we're eating. I mean, a lot of it has preservatives and chemicals and toxins that is not good in the body. I mean, think about back in the day. I mean, I used to remember the milkman, right? How long did that milk last in the fridge? It was like less than a week. Look at how long does the milk last in the fridge now? Like a month or more.
Got a point. And plus, it doesn't taste the same. If you notice that a lot of the foods have changed over the years, and even the taste, and it's because of more preservatives.
Yeah.
So do you think that right now, as we are going into this new arena of 2025, do you feel confident that diabetes will start to, not diabetes, but neuropathy will start to go down and start to taper off? Or do you feel that we're still haven't hit that plateau of where we're going to continue to rise up in the numbers?
I think right now, if you're talking about for the next 10 years, I think
Yes,
it's
next 10 years.
continue to rise until
Why would you say that though?
because there isn't really solutions out there. There isn't many docs that are trying to figure out the natural ways instead of using toxins and medications and stuff to mask it. I mean, that's chemicals, that's toxins that you're still putting in your body. Masking it isn't a long-term fix. So once doctor thoughts and they start, instead of going into just medicine and thinking about, hey, we can do these other things, then that's where it will start to decrease.
What I don't understand, you're a doctor, and there's of course different types of doctors of medicine, and of course of certain type of niches that people work in and they specialize, like yours is neuropathy. And being a doctor, at least correct me if I'm wrong, but like, you have to have some type of heart at first in the beginning of wanting to become a doctor, of saying, I want to help heal people. I want to use these hands that have been given to me by God to help heal people. I don't understand the mentality. Do they just not know that they can heal, or are they just okay with these other type of doctors, okay with just giving them a pill to patch it, and then knowing that they're going to be taking more pills and it's going to continue to get worse? Do you think that is something that they realize, or do they think that they're healing these people slowly?
No, I mean, medical doctors are great, right? They're great at acute care. This is considered chronic care.
Okay, chronic.
And as chronic care as a system, in the medical world, they're terrible. Okay. But for acute, like, hey, surgeries or quick, acute things, those they're great at. But it's the long-term chronic, like diabetes, or, I mean, if I'm reversing diabetes, why isn't other doctors doing that? Right?
I think it's all about the money. That's my opinion, of course.
Well, it is. Part of it is insurance companies. They kind of dictate what will be covered and not covered, and especially in the hospital setting, it's huge on insurance and pushing the drugs because those are covered by big pharma, right? Pharma, it's a business.
Right.
Pharma, helps the insurance companies. Insurance companies dictate what is covered, what's not, and it's just a game business. So medical doctor, I mean, it depends on specialties too, right? I mean, if you're going to a cardiologist, you have a heart attack, well, yeah, they're great. Get you back, get things fixed, get
Amen.
vessels clean. Yeah.
That's their lane.
Yeah. But for long-term things like that, it's just, they're not there.
Okay. Wow. Amazing. Okay. Well, I'll tell you what, I'm seeing that there's so many things that we can talk about that are varying off, and I'm trying to stay within the neuropathy, and I have a funny feeling we're going to be doing a lot more episodes just on neuropathy, because there's a lot more to it than just saying, okay, it's inflammation or it's blood flow. And I believe that the more information that we continue to pull out there, especially in your area and of course around the world, because I know that people fly out to you, because they've seen and heard your work of what you're doing for other people. They're actually being healed, reversed, and if not, they're feeling a lot 80 to 90 times more better. I mean, I've seen your reviews. I've seen your video reviews of people talking about what you've done. So, before we end this show right now, which there will be another one, what would you like to leave right now with, if you could say one thing about neuropathy that you believe that people need to hear, and not just need to hear, but why they need to call the phone number on the screen so they can at least talk with you about this?
Well, it's because, why do you want to keep living that way? Why do you want to just sit around in pain where you want to go and do something, especially with your family? Or, I get people that, hey, I used to golf and I can't golf anymore because my balance is off. Because neuropathy will affect your balance eventually.
Wow.
Or
So,
someone that loses a limb because of neuropathy. Well, that's because it got infected because there's no circulation going to the area to heal that lesion. And then instead of it spreading through the body and killing you, well, we're going to amputate. So why sit and go through that? And now you're in a wheelchair. Right.
right.
So if you're want to be more productive and active and create those memories still, then why not?
No, I agree with you. And to those people out there, before we end the show, I just want to let you guys know your why needs to be bigger than your why not. Think of something that means so much to you. Sometimes you got to put yourself away.
Before you end, Mark,
Your grandkids.
I think our next podcast, which we'll do soon, I'm going to grab a few of my patients.
Oh, come on.
And then you can ask them all the questions you want. How they felt, how they felt through going through our clinic, and then how they feel now.
That's huge right there.
Yeah. Yeah. I mean, we'll get some people locally that work in the community, that are well known in the community. We'll bring them on. They're okay with sharing. So I think we should do that.
No, we will do that. And again, I just want to say thank you so much. Wish we had more time. We'd like to keep these segments short and sweet to the point. Why? Because the attention span of people these days are just really short. So we want to have short, impactful, and compact of what we're doing on the view, especially of neuropathy right now. And so, like I said, my friends, your why needs to be bigger than your why not, whether it's your grandchildren, whether it's to be with your loved one, or maybe, you know what, you don't have any of those why. You need to realize that you're worth it. You don't need to live in pain anymore. So again, thank you so much, Dr. Mo. I appreciate you for being here, and you're a blessing, and I love what you do. You're helping people, and you're saving lives. I don't care what anybody says. You're saving lives, and thank you so much.
Well, thanks, Mark. Appreciate it. Hopefully we'll see you soon.